Imagine you just had surgery, a minor accident, broke a bone, and you were in pain, and you needed something to treat that pain. And you were told, no, you can't have that, because laws or guidelines say so. Imagine you went to the emergency room in pain and were told, this emergency room doesn't give narcotics anymore. Well, imagine that's your life every day, for the rest of your life. I'm TJ, and I'm a chronic pain patient. I'm dependent on opiates to get through my day. It's just a fact. It's nothing I'm ashamed of. Doctors in this country are being scared to prescribe these for these patients. They are threatened with their license, criminal charges, jail time, huge fines. Over 50 million people in America are chronic pain patients, according to the CDC, and only 20% of them are treated correctly with opiates. They may make that sound like that's a lot, but what about the other 80% of those people? Every year, productivity in our economy is down by 60%. That's estimated a $61 billion a year loss. All because of being untreated because of your chronic pain. These people who can no longer work, what are they supposed to do? They sit home, they become depressed, and depression causes pain. Pain causes depression. It's a vicious cycle. Imagine you go to your doctor to get help for this, and you're told, I can't help you. The guidelines say no. The rules say no. This isn't exactly true, but doctors are so afraid that they act like these are hard and fast rules. In 1970, the Controlled Substance Act was instated, and that's been the rule ever since. But new guidelines, out of fear, because of the opiate epidemic. The opiate epidemic is very true. There are many people overdosing. Very, very true. You see it on the news all the time. In every small town, every major city, it's happening. But did you know that most of the people who overdose on opiates, they were not the ones that were intended to be a prescription for. The prescription was not intended for them. They're usually stolen or bought, obtained illegally somehow from a doctor who wanted to make a quick buck. But most of the time, they are not the ones it was prescribed to. Also, did you know most people who overdose don't just have one prescription or one medicine in their system? Usually it's combined with alcohol or benzos or street drugs. It's almost always a fact. CDC states that enough opiates are prescribed every year for every adult in America to have a bottle of pills. While that may absolutely be true, one bottle of pills is barely a month's supply. Imagine if 12 months out of every year for the rest of your life, you need those to get out of bed. I can't get out of bed some days if I don't have them. I can't wash my own hair, dress myself, do things with my family. That's not a life that should be lived just because of the propaganda, the scare tactics, and the fear language used. I am no way saying that we don't need to do something. We absolutely do. Doctors need to be monitored. There needs to be rules set in place. But taking a whole community of people, 50 million people, and telling them they cannot be treated, that would never happen to a diabetic or somebody with cancer. Yes, there are other medicines that you can treat pain with. A lot of people say NSAIDs like Advil or Toradol or even stronger ones. A lot of people can't take them. I cannot. And let's be honest, those help the inflammation, which is great, but it doesn't help the pain, especially if it's all over your body. Cannabis is another great solution. Problem is, it's not legal in every state. And in the states it is, not every syndrome, not every disease, not every disorder is on the list and approved, and it takes years to get that through legislation. Our doctors need to be our advocates. They don't need to be afraid to treat us. Doctors in record numbers, especially doctors that specialize in pain, are leaving their practices and even leaving the profession altogether. Nobody should be that afraid. I belong to many support groups online for people with my disorder specifically and for chronic pain in general. There's not a day goes by that there's not a post about somebody who lost their medication, lost their doctor, and sadly not a week goes by that there's not a post that somebody committed suicide. I personally know of a man in his 50s, owned a business, had a family, grandchild, another one on the way. First he was cut down. He dealt. And then he was removed altogether. Crawled into bed for a few months. Tried. Couldn't do it anymore. Wife goes out shopping, comes home, finds him dead. He killed himself. That's becoming the real epidemic. Now, what if 50 million people were taken off their pain medications? What if half of those people, a third of those people, decide to kill themselves to end their suffering? Would that be considered an opiate epidemic? A mental health epidemic? It is happening. It's happening now. You're just not hearing about that. Please do some more research on it. And next time you hear a story about somebody who is on opiates long term, don't judge. Next time you hear a story about somebody who overdosed, look at all the little details. Where did they get the medication? What else did they take? Were they drinking? Most people who are prescribed opiates for chronic pain take them the way they're prescribed. Simply because if you run out, you don't have pain relief. Simply because withdrawal sucks. Nobody wants to go through it. You're sick for a few days, your muscles hurt, you sneeze a lot. It really sucks. But the pain gets worse if you don't have them. So why would they abuse them? I'm not saying it doesn't happen. Of course it happens. But that's an exception to the rule. Instead of using fear language, let's use real statistics. Let's use facts. Let's not treat people with chronic pain who require opiates as second-class citizens. Let's not fire them from their doctors. Let's not take away their life-preserving medication. We wouldn't do that to somebody with any other ailment. Any other ailment, we would never take away their medication that preserves and prolongs their life. Suicide is a real and what's happening now side effect of this war on opiates. Yes, we have to do something, but taking these away from people who need them to survive, function, take care of their kids, work, is not the answer.